It's Angela Williams speaking from Mount Vernon Cancer Centre in sunny London today. So we thought that we'd like to just share some of our short thoughts with you on the session that we've created around an introduction to radiotherapy. We have mainly used this with staff within the Cancer Centre. We've used it for a lot of volunteers, for doctors, physicists, staff from nuclear medicine, people in admin roles and research roles as well. We've also used it with some students, and it could easily be adapted as well to use with patients also. When we've used it with students that have attended, we've mainly used it for those that have been under 18, because we have a rule here that they're not allowed to come into our treatment areas, and they've found it very beneficial. And from these sessions that we've run, we have evaluated them using some questionnaires before and after the session, and these have shown that participants' knowledge and confidence with speaking to patients has increased significantly after the session. So we were really pleased to see that these have been used really successfully within our centre. So in terms of the introduction to radiotherapy, we started that off with creating a virtual presenter, and I think that Jan circulated some software in regards to that prior to the session. So we used some screen grabs on some of the aspects throughout the patient, which you're going to see in a minute. And we also have some PowerPoint slides which have been added through the use of PowerPoint, and we've loaded those as JPEGs just to provide some written information throughout the session as well. Okay. The first few slides are fairly self-explanatory, so we'll move through those fairly swiftly.
Is there any questions up to now, just in terms of whether you see what you for?
Everyone will need to type in the chat box, Avina, everyone's muted.
Yeah, to type in the chat box, yeah. Just to give gauge where it is with it, what their thoughts are.
So I'm just trying to load up the first slide here. Thank you. So in terms of the aims of the session, we're really just looking at to increase people's knowledge of radiotherapy and what radiotherapy is.
You should be able to select it now, Angela.
Okay, all right, let's try again. Thank you.
There you go.
Okay, perfect. So in terms of the workbook, we're looking at just a bit of an overview on how radiotherapy itself works, looking a little bit at the mobilisation as well, and just describing the patient's journey through radiotherapy, so it was clear to others exactly the steps that patients took in terms of going through the and then through to the Linac treatment. We also looked at anatomy within the session, and also looked at radiotherapy side effects too. So in terms of what is radiotherapy, there is a video there that you can have a look at as well, but we also use just this written information just to, again, give a little bit of background knowledge to participants. So I'm sure that all of this is familiar to you, and of course if you wanted to adapt this or add in extra things, then you could also do so. So this gives just a bit of background to radiotherapy, and then what we do after this is go on to a little bit about the cell cycle, and just reiterating to the participants that the most effective area of the cell cycle for radiotherapy is when the cell's in mitosis, and explaining a bit about the dose and fractionation and why that's important. So these slides we ordered on PowerPoint and then added these in as JPEGs just through the virtual presenter function. Now we've also got a little bit about radiobiology, and again just talking to people that are there about all these different aspects of radiobiology which are so important to us in radiotherapy. On the attendees workbooks that you have there, it also goes into information of the specific information we give on this slide. We then also go on to what's the difference between radical and palliative radiotherapy, and talk about the number of treatments that would be relevant for each, and the intent of those as well. We do try to run this as a really interactive session, and we find that as soon as we get onto the next few slides, where we talk about the VERT aspect and use this in more detail, as you can see here, then this is when the participants really start to ask questions. So from this slide, we're really looking at the lasers, and then encouraging the participants to have a good look around the patient, explaining that with our scanning procedure that we're only scanning a certain segment of the patient, so they realise that obviously the rest of the patient is here, this is just the area that we're interested for our radiotherapy. We also have a look on here and set the distance indicator so that we can explain about the distance that we use within radiotherapy. So on here we've just got one of the screen grabs of the workbook that we have devised, and hopefully this will be quite useful to you because it tells you what the slide number is. So we just did the one that was lasers then, and it tells you on here what to do with that slide, and then on here it just gives you a bit more information in terms of suggestions that you might want to do when you're poised on that slide delivering the information to participants. Okay. So the next slide, as you can see, is the one where we look at the FSD and then play the beam. So onto here, this is the next slide, and again we would scroll around the patient, and then up in the beam, up at the top right hand corner, we would then press play, just so that we can show the participants the beam moving around. This is where we also explain about the imaging panels and the length of time that it takes for a patient to be treated, and also the fact that obviously they can't see or feel anything. So we talk about treatment length and watching the patient on the camera and all that sort of thing. We also explain that this slide is in real time, so that they get an overview of how long the patient's treatment would actually take. There's a slide a bit later about the MRCs and moving to shape to the volume, and we will cover that just a little bit later. So once we've gone through those, we then have a little bit of a look at the mobilisation. And on here, we've got the knee pads that we would use, which, again, this is from the virtual human within the virtual software that is provided at the beginning. So it was a screen grab there of the virtual human so that we can just go through what a mobilisation that we would use. We also talk prior to this about the fact the patient has the CT scan first, and talk about the tattoos as well. And then on the next slide, we've got about our breastboard, and we also speak about how the patients would be immobilised on here and the position of the arms, and how they're also scanned in this position, so that people are aware of the procedure through CT as well. And then on the next one, we've got about the electron applicator. I'm just going to take the beam off there. So we then would explain a bit more about the electron applicator and how the treatment differs with the electrons. In terms of immobilisation, we also bring a head and neck shell with us to the session, and we pass that around to people that are there. And we also take a flat sheet of the shell making material, so our ORFIT. We take a flat shell so that they can see how the material comes to start with, and we explain about how it's heated to ensure that we can mould it to the patient's face. In terms of the electrons, we also take over, we have some electron masks that we use for our patients here. So we take those over as well and pass that around, and participants are quite often quite surprised about how heavy that electron mask is. Those are the first few slides in a nutshell, which I've gone through fairly swiftly, as I think that most of those are going to be sort of the bread and butter of everything we're doing. Avina's going to go through now just over the next few slides through from the anatomy.
Thanks, Anne. So just to say as well, the workbook is divided into 3 sections. So as Anne has just gone through the first section, which is just giving you everybody an overview, and then the second section, so you've gone through 1 and 2, and then the third section is about treatment and anatomy, and it's really just to demonstrate what the organs are and how the beams affect the organs, and then the last section talking about side effects, so we try and then link that to the side effects as well. So looking at the first slide, the anatomy slide, just going to show you when we scroll around it and look at the surface anatomy initially to demonstrate, particularly to students, what we mean by that, and then also looking at the internal organs. This one we've got a pelvis slide, so we've outlined all the internal organs with the different colors so that we can talk about all the different parts of the anatomy that's affected. So we ask just as a generic, some of the structures we ask the participants to point out, just to get some interaction as well. And also we talk a little bit about the planning of it and how we want to try and avoid any of the structures we don't need within the radiotherapy field. In this one, we scroll all around to the side as well so that they can see what organs are within that beam. The next slide talks about the CT slices within that area. So for this one, again, it's to demonstrate what we would see from the CT scans they have and how they're related to these organs that we've outlined. And we scroll up and down using your first slices. On the right there. So I'm just demonstrating scrolling up and down. We also look at the coronal slices when we scroll to the side, again, it's really just to show all the anatomy, bony anatomy as well, and what's within all of those areas in that field. So you can look at all the slices, sagittal, coronal, and look at all the organs within that. I mean, you could have any site you wanted, but we've picked prostate for this particular workbook. We also then, onto the next slide, demonstrate the dual view, which is really quite useful, especially when you want to look at the MLCs. So we then talk a little bit about what MLCs are and what they do and the function of them. And we would often also play the beam at this stage as well, as you did before, on that right up, selecting your play beam, which demonstrates, and we then talk about how the MLCs move in and out and the organs that are affected or the ones we're trying to minimize dose to. And it just gives them a good indication of what's happening with the field and how organs are affected. These parts of the workbook, the participants find really, really useful to be able to see this bit, particularly if they are in the medical field and particularly if they are students as well who want to do radiotherapy. What we do also have on here is the CBCT tool. Often we'll at this stage also bring that up to show what we do at the front end and what happens when they're taking a CBCT image and what that all means, just as another addition to show what VERT can do, and also they're able to see what we're seeing at the front end, and so we're able to explain a few things around that, especially if people are in the medical field, they're quite interested. Okay. So we're just going back to the virtual presenter to see if we can, yeah, there we are. So the next slide after the CBCT match, it talks about distributions, and this is really just to give them an idea of how radiotherapy has changed and what distributions look like. So, I mean, these are just still images that we've taken from, we've just done one slice across the pelvis and screen grabbed 3 different images and then put this on a PowerPoint to show on the virtual presenter. As you can see, you're probably aware of this, we've got a conventional image, we've got one with an ARC and one with IMRT. But these are still images, and those are the things we explain as well and demonstrate the areas that are receiving the radiotherapy. Also looking at where the rectum is in relation to the area we want to treat, so that we can demonstrate how technology has changed and how it's developed and how it's helped us in terms of treatment planning and avoiding some of the organs at risk. This often generates some discussions as well, especially if you have people like, if you have volunteers who've had radiotherapy before, so it often generates quite a discussion. So we then move on to side effects. You guys probably already know a lot of this. So basically what we're doing with all the side effects is we go back and relate them to what we've shown in terms of all the slices and MLC and organs at risk, and so that they get a very clear view of why the patients expect side effects. So I'm just going to run through the next few slides just quickly so you can quickly see what we've shown on there. Then I'll come to this. So these are the next couple of slides we've put up where we've taken images. These are from a different patient and taken pictures of that and put on PowerPoint as JPEGs just to show how we treat it and the organs within that region, and then the side effects related to that. So it's a really useful tool to be able to demonstrate that as well. We've done the same in the next slide, as you can see, with the thorax, pelvis as well.
And then the last slide that we have on here is we get quite a few questions just in regards to dose and the shaping of the radiation treatment. So we tend to just have this slide here, as it just enables us to explain quite well how it's conforming to the area we want to give the treatment to and reducing dose to any normal tissue. So we use this one as well to talk about how we can also potentially treat the primary tumour and nodes as well, within the same volume with different dose ratios.
This whole workbook that we run with almost takes us up almost an hour. Depending on obviously the interaction you have, it can take a little longer, but on the whole, an hour is how much we tend to, given all the discussions and interactions. And what you'll find is when you use it, you do get a lot of interaction because it is so visual and it generates a lot of discussion. And of course, you can take in with you as well, as Ange mentioned, any other devices you might use, which also helps with the discussions, like the masks or anything else that you might use. We do have had questions about new treatments as well, which we also tend to look at, not through virtual, but just tend to answer around proton therapy and anything else that may be out there. So we would advise do your homework a little bit before you go, as you do get questions that people have read up on as well.
And I think in terms of this presentation, in terms of putting it all together, because we needed to obviously outline the different structures, some of those were taken from other virtual presentations that we'd already put together, but trying to grab everything together and then outlining for the head and neck and all that kind of thing, the whole thing probably took us about 15 hours to put together, as well as the workbooks. Mm-hmm. So it does take quite a while to prepare, but once you've got it there, then you can add to it, you can amend it, and it's quite useful as a sort of a dynamic document, really, to just change and amend when you need to. So hopefully that will give you a few ideas as to how you might be able to use the session. I think as well at the end of the workbook that I think Jan was just showing you, just trying to get back into there. At the very end of it, we've also got some suggestions for a reflection and also some further reading here as well. So you can always direct participants towards this as well. And they're quite a useful resource, we've found.
I think that's the end of what we want to present. If there's any questions, happy to answer.
I've just typed a question into the chat box, Angela and Avina. And everyone, I'm just going to unmute you now if you have a question.
Okay, great. Thank you, Jan.
Yeah, so we've got a question here about relation to consent for the patients. We're quite lucky in that on our consent form that we give out to the patients, we do have a separate statement within the consent form which says that patients are happy to have their images shared.
Everyone should be unmuted now. We've had a question in the chat box, actually, Angela and Avina. Quite a few questions, actually.
Okay.
By using the virtual presenter, what document, if any, does the student walk away with for their study purposes?
So with this document here, I think this is the ND one, but we also have a participants one as well. With the participant one, they can actually write as they go through any comments or anything that they want to put into the box. So they can have that as something that they can use for their reflection afterwards as well. And in terms of having easy access to the PowerPoint, you could supplement this with just the separate individual PowerPoint slides that we've created that could then go to students afterwards. So you could also use that as well as a tool to give out to students. That would be fine.
And that's actually in the Introduction to Radiotherapy workbook folder as part of the 3.3 release. You can just see that there.
So with this one, what we did is we loaded up another patient so that we could get these two images. So what we did is we got it to the position that we wanted it, and we did a screenshot of the images and saved it to Paint. And then what we did is with the written work we'd done in PowerPoint, and we were then able to insert that in and then pop that into Virtual Presenter.
That looks great. And the other thing that obviously people can do, just showing that how you would do that in the Virtual Presenter, if that's okay, you have for example, a side effects slide here. If you right click and then do Edit Slides, Edit Layout, you can move the slide to the corner and change the size. So that's how that was achieved.
Yeah, thanks, Jen.
Not sure that's a tool that everyone is aware of, and it is a really useful one, used very nicely in this example. Does anyone have any other questions they'd like to ask? Everyone's unmuted. What sort of feedback have you had from some of the participants, Angela and Avina?
We've had really excellent feedback, actually, and we've got a poster that we're actually sending into Estro on the reflection of the feedback that we've had, because we've done this session now with over 50 participants, and it's been evaluated really well. So we've looked at a scoring system that they scored themselves prior to this tutorial between 0 and 10 of confidence, of knowledge of radiotherapy for one, and confidence in speaking to patients as another. And both of those have increased significantly, statistically significant after the session. So that was really pleasing.
And one of the things a lot of people said to us was that especially the images and everything has made it quite real for them, and helped them really understand what it means when we do treat with radiotherapy. It's been quite useful for them.
I think the other area that would be quite useful would also be sometimes we go out to schools, to open days or to careers fairs, just to promote what radiotherapy is as a career. And we have taken a session similar to this one. We didn't have this one ready at the time, but I think this would actually be really useful for those careers fairs as well, because it does give quite a lot of information, which I think students would find useful.
I'm sure they would find it really useful. I think you've explained it so well, Angela and Avina. So thank you very much to Angela Williams and Avina Shah from Mount Vernon, who are our presenters today. Thank you to everyone for joining the webinar. And if you have any ideas for webinars that you would like virtual to run, then please email us. With that, I'm going to stop the recording. Thank everyone for attending.